So are there like a lot of experts or science like that people can look to learn more about like how this works, like why tapering has to be done very gradually?
I mean, the Ashton Manual was kind of like the old school, like landmark document that existed since the 90s, when she had a clinic over in the UK where she worked with patients to withdraw them slowly. And then she wrote the manual based on her experience with those patients.
Yeah,
Um, so that's kind of the first document that exists that explains this. Although she didn't go into the difference in language, the difference between physical dependence and addiction in that document. And I think she used um, addiction language incorrectly
yeah,
in that document. So now we have, as of this year, the Maudsley deprescribing guidelines that were just released. And that the authors of that are Mark Horowitz, who's a psychiatrist in training in the UK, and Dr. David Taylor, who I believe is a psychopharmacologist who's well known in the UK for his work. And Maudsley is a very respected textbook in the UK. The textbooks by Maudsley prior to this one are all called Maudsley prescribing guidelines. So it's all for psychiatrists and doctors about how to prescribe psychiatric meds. So the latest one is the Maudsley deprescribing guidelines. It's the first of its kind, and it's incredibly detailed and thorough because Mark, who is one of the co-authors, is a psychiatrist in training, but he's also a patient. And I've heard him say he considers himself a patient first because of what happened to him trying to withdraw from psychiatric medications, including benzos and sleeping pills that he was on. And so he's written an incredibly thorough textbook about all the different ways that people are tapering these drugs at home on their own. And he had contributors to the book. I helped with the benzo section. Dr. Christy Huff, who's passed away, but was our medical director at BIC, also helped. Um, and I think he has in there, gabapentin, Z drugs, benzodiazepines, antidepressants, everything that needs to be tapered slowly at home on an outpatient basis. So this can be bought and you can take it to your physician if you're a patient out there and you find yourself in this physical dependent state and having trouble withdrawing. You can educate yourself with it, but you can also take it to your doctor or PA or nurse practitioner and use it as a tool to sort of convince them like, hey, this is a well-respected textbook with all the information that we need to safely get me off of this stuff at home in the way that it's supposed to be done. So that doesn't mean you're guaranteed to have still an open-minded clinician who's going to read it and listen to you, but it at least it's sort of a tool in your toolkit to try to be better understood and taken seriously when you walk in there. So,
yeah.
yeah.
That's a good point. That kind of reminds me of I I remember hearing in a lecture that if you have a if someone has a legal problem, they're going to a lawyer that you expect your lawyer is going to handle your case, and the truth is um, that you need a an expert witness or an advocate, and they say that you're your own best expert witness. Oh, sorry, just declining a call there. That that you can't expect a lawyer to handle your issue. You need to be your own expert witness. You need to get deep in the case and review everything and act like you're your own lawyer and learn everything and kind of put it together and package it up in a way that can be easily understood and say, this is what my real case is here. That you do need the professional, but you need to be your own best advocate and really educate yourself. And it's not just true for working with a lawyer; it's true for working with a doctor. That if you go to see a doctor that only has 15 minutes to see you and they're in a hurry and they've got 50 people on the schedule for that day, um, if you walk in and say, I need to taper, I need you to prescribe me this liquid compound, and I'm going to take a little bit less on a regular basis and follow this tapering schedule, that might work. Or they might say, like, where'd you get this from? On Google, and then they say, like, you can't go to Dr. Google, listen to me.
Mhm.
And then the next thing you do, if you bring in this book and say, here's this um, deprescribing guide, written by scientists and experts in the field, and this is real science, this is a real medical textbook. And if you say, I've read it through for you because I know you don't have time to read it, um, and I've put together a plan, and this is going to work. And is if you want to read the book, you can. Having that authority, and also having done some of the work, and that can, I think that can go a long way. Like that we really need to be our best advocates, or even to have somebody with us, to bring somebody to an appointment that can also can stand up for you. Maybe a spouse or a parent or a family member. Somebody. It helps if you have somebody that has some medical knowledge, and or that can, but to um, not to fight the doctor, but to say, like, I know you're in a hurry and that you don't know a lot about this, maybe, which is understandable because nobody teaches this stuff. Is anti big pharma, which unfortunately the medical education system has big pharma is so deeply entrenched. That's probably a big reason why there's no science about this stuff, or not much science. Of course, in the UK things are different, but definitely in the US, our medical education system is so infiltrated by these drug companies that have no intention of anybody ever getting off of these drugs. But yeah, so if a patient can go being their best advocate, and maybe bring somebody with them to advocate for them, and they have also this medical book that has all the information in it, and you've also put together a plan. I mean, I think people can possibly, in a lot of cases, make things work with their primary care doctor or their family doctor.
Yeah, totally. I mean, one of the number one emails we get is, at Benzo Info Coalition, we have a doctor's list that has physicians, you're on there, who are willing to help people taper benzodiazepines. But we have above the list is a huge disclaimer that says, just because somebody's on this list does not mean that they're super educated on proper benzodiazepine tapering. Like, at best, what you're probably going to get is a collaborative physician, PA, nurse practitioner who's willing to prescribe you the drug, but they may not know all of the tips and tricks and things in the Maudsley book or in the online forums that you can learn for yourself. And so people will write us and say, well, I went to this doctor and they didn't like design me a microtaper. And it's like, well, they're probably not going to. You're going to have to figure that out yourself with a coach who knows how to do that, or in some of the groups, you can read, and in the Maudsley book, you can read. So yeah, it's unfortunate that you have to like dive deep into a textbook and learn how to save yourself from this situation, but it's just reality, unfortunately, with the landscape of our, this gap in like medical knowledge that currently exists. It's you're just going to have to do that unless you are one of the rare few that is incredibly lucky that, comes across you, Dr. Leeds, or lives in the state where you're licensed, or, maybe Joseph Witt-Deering in the few states that he's licensed in. I mean, there's a handful of physicians who are like top of this field and could manage a taper for you in that way, but most of them are not going to have any idea, and so you're going to have to be the one who drives this, and then your physician or uh, prescribers just kind of like your co-pilot essentially along for the ride, and maybe they learn from you. I've had tons learn from me, and then they can take it forward to their next patients, and do better next time. But yeah, you may just be getting somebody who has no idea what they're doing, and they're kind of relying on you to tell them what you want to do. In other cases, we've even had patients who had to lie in order to save themselves and say, the drug is working really well for me. I'd like to keep taking it, because they feared if they mentioned that they were trying to withdraw, that the patient would try to take over. I mean, the doctor would try to take over. And that happens all the time. I don't know why. I don't know if it's an ego thing with physicians or a control thing or what. But as soon as you mention taper, they start saying to patients like, oh, all right, well, you can do it in a month. Cut it in half again, and you'll be done. And when the patient says no, then they're like, well, that's how we're doing it. And so some people are just terrified to even bring it up in the first place because they kind of know the vibe of their doctor. They don't feel like they're going to be collaborative. So they just pretend like the drug is working great, and then they go home and read Maudsley themselves or hire a taper coach or something and devise a plan, and then they just do it on their own behind the scenes. And then once they're off the drug, they just like never go back to the doctor, you know? So that's the least ideal way. Obviously, we'd like everybody to have somebody monitoring them who cares about them and wants to know that they're okay and who's like on board with the plan. But again, that's not reality in all cases. So,